Hi, everybody. Thanks for joining us on your lunch break. I'm Dr. Jen Johnson, and I am so excited to have as my guest today on IVAPM Live, Mikkel Becker, who's a fear-free certified animal trainer. And we're going to talk about fear and pain. And Mikkel is a certified trainer and a behavior consultant, and she's the lead trainer for Fear-Free Pets. So you may have watched her webinars before if you're fear-free certified. She lives with some pets, Indiana Bones, I love that name.
He's my buddy, my bestie.
And Otis, so they're pug mixes, which is great to have that breed for trainer and for pain management for sure. Mm-hmm. We love that. And you have a horse too, where you've done a bunch of training, reward training with your horse, which I think is wonderful. That's great. And the book that I read of yours is From Fearful to Fear-Free. And before I read that, I didn't realize that you had authored 5 other books. So you're a busy lady.
I am. It's fun. I love being able, it's funny, when I was little, I used to get in trouble from my teachers for only writing animal stories. And now it's what I do for a living. So it must have been meant to be from a very young age.
That is pretty awesome. Being able to do what you love and love what you do is really why we're all here. So I am so excited that you agreed to do this during September, Animal Pain Awareness Month, because we've had a really busy month at IVAPM. And I love that this group that we've gotten together is a combination of veterinarians, veterinary professionals, veterinary nurses, technicians, anybody who works directly in veterinary health, animal health, combined with trainers and behaviorists, because I think that this is a union that we really need to talk about. And that's why I was so excited to have you here, to be able to kind of talk about how pain impacts behavior and maybe can help or can hold back the training process, but also how maybe trainers and veterinary professionals could work better together. Those were the ideas that I had, and I'm sure you have some experience with this, and I thought that that's where we would start talking.
Absolutely. I think that you hit on so many key points right there. And so many times there's such a separation in different aspects of pet care. There's, perhaps the pet shop, there's the veterinary office, there's grooming, there's the trainer. And what's so important is that we all are partnered together, because there are so many ways that we really are missing these times when we can reach out and help these pets. And as a trainer, I find it so important to work with different veterinarians and with different veterinary offices, and to work really in depth with them, because it's so important to be able to partnership with them and to be able to provide the right kinds of resources, from socialization classes to interventional training, and really couple that with the veterinarian's oversight. And pain, I found in my personal experience training and doing behavior consulting with different veterinary offices, and also with different veterinary behaviorists that I've helped and have shadowed, really pain is such a big component. And a lot of times that's underlying the start of a behavior problem that an animal has. And perhaps that pain is ill managed, maybe the person hasn't taken their pet in as often as necessary, or thinks, okay, this is just a sign of old age, when there really is an underlying issue that needs to be addressed. And a lot of times too, even when that pain is gone, some of those behavior issues may persist. So for instance, the animal that was doing perhaps excess licking or chewing of their skin or things like that, with that discomfort, a lot of times things like that can still ensue in situations when the pet's in conflict or anxious. And so it's really important to have that partnership and to really get that whole pet perspective on being able to help them from all sides, with the veterinarian really spearheading that whole effort.
Yeah, I was wondering if you had an experience where you were presented with a behavioral case that they were maybe even a referral from a veterinarian, that this is a particular dog that's a really behavioral nightmare, where you ended up going back and saying, I think you might be missing pain.
Absolutely. Actually, I get that all the time. I would say probably in about 10% of the cases with dogs that I work with, whether it's reactivity, the dogs that are barking on leash at other dogs, a lot of times pain is underlying that, or a situation like noise anxiety. A lot of times there's underlying pain in that, or one that issue that seemed like just a very common issue for a lot of dogs is getting in and out of the car, the dog that's reluctant to go in. And so working with the pet parents and with their Labrador, it was a young Labrador under a year of age, but was having problems going in and out of the car. And they thought it was just the dog was being stubborn, maybe didn't want to leave doggy daycare, had so much fun that it was kind of bummed out to go home. And when I started to work with them and looked at it as a training issue, almost right away, when I started to ask more questions in depth and really watch the dog, I could see that there was something a little off and it wasn't a normal training issue. And what it ended up being is that the dog did have a lot of pain. It already started to have a lot of joint pain, was probably going to have some surgeries. And so by being able to get that early intervention, we were able to treat that dog and get the veterinary oversight and guidance to prevent more progression of that or unnecessary pain for that dog. And with that, we also gave the dogs the skills to be able to get in and out of the car with ease, and helped in a lot of other issues that dog was having, such as reactivity to guests and to other dogs. And I think pain was a component in all of that for him.
Yeah, and I often think about behavioral issues and training building on itself, and the limited amount of dog training that I've done with my dogs. It reminds me of as a veterinarian and somebody who's interested in pain management, the idea that if we have an acute injury that's not taken care of, it builds into a chronic problem. And it seems to me that that's kind of the equal as to what happens with these behavior issues that start with pain, that they become worse and worse, and your final behavior, aberrant behavior, is uncoupled from the original problem. So besides being hurting, getting in and out of the car, this dog now doesn't want to even do something else that doesn't seem related at all to the pain in its hips, but it just builds and builds. And I think that that's probably a critical point that people need to be aware of, especially in veterinary medicine, that these behavior problems may look like that they're not directly related to the actual pain. Like ear infection, why don't they want to do this? That doesn't seem to match, but just think about if we're painful, the things we don't really want to do kind of thing, for sure. So tell me about what happens when you have these pain, this animal with pain. How does it really change their training? And what kind of things can you pick up from when you're seeing a dog with training that might be helpful for even pet owners to notice, or veterinary professionals to notice? Anybody things that you're more in tune now because you're training these dogs. What do you pick up on?
So you can see a really big difference in changes in their behavior, but also their movement. So little things that the pet parent may not even notice, or that they may chalk up to old age, or that's just how my dog is. If they're slow to rise, maybe they are walking with an abnormal gait, they're doing more of like the bunny hopping as they run. So different things that just look a little different, or it's a big change in that dog. So something even like not playing as much with their toys, that can be a big sign of an underlying medical issue. And maybe it's dental pain, maybe it's something like a cognitive decline, maybe it's, that underlying pain. There are so many different things it could be related to. And so being able to talk with the pet parent about, has your dog always been like this? Like, have you noticed this change? And then also being able to really talk with them about the importance of treating pain. And I don't think anybody intentionally ever wants their pet to suffer. Pets are our family. We want, to love on them and to do the best thing that we can for them. But unfortunately, a lot of times the fear of taking the pet into the vet, so the fear that it causes to the dog, and the stress it causes to the pet parent, or also to the cat or any other species as well. Really, I think every species and every pet parent can really relate to that. It can be very stressful. And so that's where being able to educate them about fear-free and being able to have that emotional protection and that emotional bubble wrap around their pet going in for veterinary care, I think that's really essential, because unfortunately, what I've seen a lot as a trainer and working with different veterinary offices is that a lot of people will get their main advice from someone that may be like the pet store employee who has a miracle food, for instance, or something like that, where, okay, this is going to fix all of your dog's joint problems. And However, so when I'm working with someone and I notice something like that, I can then ask, hey, when was the last time your pet was into the vet? And for a lot of dogs, or cats, it's been at least 6 months. A lot of times it's been a year, a couple years. For cats, a lot of times, it's been quite a while since they've gone to the vet. And so being able to, as I work with the client, part of working with them is ensuring that their pet is up to date on vaccinations, and then also that they've recently seen the vet, especially if they have an underlying behavior issue, because a lot of times it really is, they go hand in hand. And so being able to also send a write-up report to the veterinarian and that the pet owner can give to them as well on, here are some of the things that I noticed. So Fluffy, for instance, isn't using her litter box. And so there may be some details behind that. Maybe she's also a little bit more hesitant to jump up on counters, and maybe the pet parents are, oh, that's fine, we don't mind at all, because we didn't like that in the first place. Or it's the dog that used to jump up and they stopped jumping up. Well, unfortunately, those things can actually be seen as somewhat of a positive to the pet parent, because, hey, we got rid of that issue we didn't like. But, they aren't really realizing, yeah, there's an underlying pain component there. And yes, we can address that behavior issue later in a different way, but what's really key is looking at the emotional well-being and the physical well-being of the pet. And if a pet is in acute pain and chronic pain, their whole entire well-being, their quality of life suffers. And so as a trainer, it's our responsibility to be able to work with that pet parent and guide them to seeking those veterinary services. And a lot of times too, it's encouraging them that perhaps they haven't tried it all, because maybe they've tried something with their pet's vet and it didn't work as well as they wanted. And so being able to talk with them that there are a lot of different options. And so really helping with that discouragement and helping them to see those things. Even something like, for instance, my pug Willie, all of a sudden he stopped wanting to do his rollover trick. Well, for me, that was a sign, hey, something's a little bit off with him. And sure enough, he did have some pretty major back issues that showed up. Or my other pug Bruce, who all of a sudden was doing, loved other dogs, enjoyed playing at doggy daycare, but I came back from one trip and he'd had 3 different altercations with other dogs. Immediately, rather than saying, okay, perhaps he's just, crabby, he's getting older. No, it was, this is not normal for him. This is very unusual. First thing we did was took him to the vet, and sure enough, it ended up being lymphoma. So, and he had a big tumor. And so a lot of times, pets are uncomfortable, they're in pain, and this is going to show up in those behavioral issues. And that's where it's really essential to get that timely intervention to be able to help that pet and to relieve that suffering.
Yeah, those are really good. Well, sad though, some of them, because you were right on top of it, but so many times people come to a trainer or behaviorist and they're compartmentalizing. I'm here because of this, because the cat won't pee in the litter box and my cat's crazy in the head, as opposed, and maybe veterinarians might be, I'm going to speak for my colleagues here, might be doing the same thing. I'm done with trying to treat this cat medically who's not peeing in the box, go to a behaviorist kind of thing. But so I think sometimes people compartmentalize and don't think about the big picture of what could be happening. And I really like the idea of encouraging trainers and veterinarians to talk about the whole picture, that it's, and I guess that's where Fear Free comes in, because that whole idea and the big emphasis we have on the idea that fear, anxiety, and stress is not beneficial at all to that whole vicious cycle of pain. Whether the cause is, sometimes it doesn't matter, because that's what a cycle is all about. What the cause was isn't necessarily, because you're continually seeing that cycle. And tell me a little bit about how you got involved with Fear Free.
So Fear Free was an effort that was spearheaded by my dad, Dr. Mikkel Becker. And what was pretty funny about the whole thing is I used to always try and encourage my dad as an animal trainer, like, Dad, you just interact with dogs a little bit differently. Or, sometimes when they come in the exam room and you get all excited, like they kind of hunker down, they get scared. And he's just, oh, Kel, they're fine. And then he said he went and he heard Dr. Karen Overall talk, and where she expressed the importance of watching out for that emotional welfare of the pet during physical care, because unfortunately in the delivery of physical care, a lot of these pets can be damaged for life with a really scary, negative, painful experience. And So he started to think about that, and wow, I came into this profession to do good for pets, to better their lives. And so from there, he spearheaded the efforts of Fear Free, worked with a lot of veterinary behaviorists and veterinarians and different pet professionals from all over. This was created by, hundreds of people. And so it's different courses. So we have the veterinary course and trainer and groomer. And my role as a trainer was being able to go into Fear Free and now work alongside my dad, who's also my best friend. We both are very, very similar and get along really well and have a lot of fun together. And so I am very grateful to be able to do the training side of things and being able to establish that partnership between veterinarians and trainers. And I think so many times that's missing, and there's like this separation between the two. And so through Fear Free and through education, what I really would want to see, and what I'm actually so grateful to be seeing more of, is trainers working more in depth with veterinarians, and veterinarians being able to find trainers that are reputable trainers, because a lot of times I know that as in the veterinary profession, you're so busy, you can get really overwhelmed. And so a lot of times there's just like a stack of business cards right there, or maybe it's the place that's the more popular place or the one that has the best brochures. But what we really want to be looking at is finding those trainers that are certified, that do have an educational background in what they're doing, and that use reward-based training and veer away from those more aversive methods and towards more humane methods, which are going to really couple and partner well with those veterinary efforts. Because otherwise, unfortunately, we can actually do harm by having our pets go to the wrong trainer and doing the wrong type of training that's going to, perhaps in the short term, the pet may be stifled. They may stop that unwanted behavior just temporarily while they're inhibited because they're afraid or don't want that painful aspect of it, that fear-evoking aspect of it. But you are not addressing the underlying issue. And a lot of times it's actually expounding it, making it a lot worse. The pet has even more anxiety, fear, and stress. And what happens is that same issue comes back with a vengeance, or other issues kind of take that place, and it becomes an even bigger mess that then the veterinarian now is kind of swimming in trying to help that pet. So that's where it's so important to be able to have the right type of training methods and being able to have someone that you can refer to and trust, and have that partnership where you also can feel comfortable that they are going to refer to you, and that they have that knowledge of how to do that. And that's one of the main things that we address in the Fear Free Animal Trainer course is, first of all, the person has to have certain credentials in order to even apply to become a certified animal trainer through Fear Free. Like they already have to have a certain certification or have gone through a certain school. But beyond that, they're also pledging and abiding by a certain code of conduct on the type of training methods that they're using, which is so important, because it really is, when it's about emotional well-being, that's where we want to protect that pet's emotional well-being in all aspects of their life, including in training, and not ever justify the use of certain methods like shock collar training, for instance, which has been shown in many different ways to not be any more effective and in fact more harmful than other reward-based training methods that we can use in all situations, including off-leash training and come uncalled training.
Yeah, well, I love that you were the spearhead behind your dad, because I think that just illustrates the point that we veterinarians a lot of times, and certainly those of us of a certain age who, Dr. Overall was one of my professors, but of a certain age where we weren't talking about fear and fear-free handling in veterinary school. And we weren't talking about the idea that if we did things a little bit differently, we would maybe be able to prevent pain and anxiety and create that vicious problem. So getting your dad to see that aha moment is certainly something that I'm glad you shared with everybody, because it makes total sense, the partnership, for sure. So what input do you think a trainer can give to a veterinarian besides, hey, I see this, but as a pet is being treated for pain or it's been diagnosed, what can you do as a trainer to be able to continue the process along once the pain has started to be alleviated? I know the education of the client for sure, and having this partnership there, but is there anything else that you would recommend that people really concentrate on as they're dealing with a pet that may have physical as well as behavioral issues that are joined?
I think what's really important is being able to have those frequent check-ins. And so that can be something that, so when I'm working with a pet owner, a lot of times it's getting their permission to work directly with the vet and to be able to send that ongoing report. So it can be that pet's progress. A lot of times those videos are super helpful. So, and as a trainer, it's important to also have some of those short bullet points, because I know how busy you can get. So to just make it really simple, here's the difference. And being able to see, it's almost like my daughter Reagan is almost 11 now, but being around her all the time, sometimes I don't even notice how tall she's gotten. But whenever my parents see her, they're like, wow, she's gotten so big. It's crazy how much she's grown. And, I think it can be the same way with pet parents, where they may not realize how the difference in their dog or in their cat. So in the way that they're walking, or, so both of those positive signs. So, wow, your pet is doing so much better. And, remember where we were at before, or when we are starting to notice certain things like them slowing down, being able to check in with that pet parent and being able to talk with them about perhaps, going back and talking with their veterinarian that maybe there's something else that they can do to help address that problem. Because sometimes, it's not always kind of like a one-shot deal. A lot of times it's working both with the trainer and working with the veterinary team to go back and forth and really find the right combination. And one other thing too, in working with different veterinary behaviorists and as a trainer, working and partnering closely with veterinarians, I think it's also important to be able to look at other aspects of that pet's life. A lot of times these pets are so highly stressed. So when you have them in that state of chronic pain, a lot of times you're going to see those behavioral signs like more agitation, more restlessness, things like that, and increase in aggression, but also like their quality of life can really suffer. And so one thing that in the fear-free certification, we have a lot of different pain courses that are directed specifically for that. And one aspect of pain that's important to consider is also the potential of adding on different behavioral medications that may be able to help that pet actually feel better and have higher, be able to retain that serotonin level a little bit better and to just feel better overall. Because when they're in that state of chronic stress, it's really, really tough. And so it's also looking at that emotional well-being. And, in some cases it's pain management, and it may also be in combination with a medication that veterinarian prescribes as well for that pet, and doing those different aspects of training, which we also want to make sure that we are doing that in a way that works for that pet's issue specifically. So a lot of times people as pet parents may have the idea that, hey, we want to stop all movement for that pet, or we want to really slow down because they're in pain. Whereas from the veterinary perspective, they may actually be increasing some exercise to get those joints kind of more limbered up and to be able to reduce some of that. And so it's being able to be aware of what that pet's needs are, or if they are on crate rest, being able to give them some enrichment. So we want to be able to have mental enrichment. And that's another really important thing that the trainer can oversee, is being able to provide mental stimulation and being able to enhance that pet's well-being through that aspect of just changing the way that they eat, changing the way that the pet parent interacts with them. Adding more predictability into a pet's life is so important. And so whether that's through having those predictable reward-based interactions, having that food puzzle feeding, having different interactive fun games that pet can do with that pet parent, all of those are great ways to be able to improve and enhance that pet's life.
It's funny you brought up the crankiness and pain, because I think about, and I think for some reason we draw a blank with our pets when we should be kind of looking at what happens in humans. I have a dear friend and colleague who's a veterinarian who suffers from chronic pain. And we always say that her meds are off if she's really cranky to the clients, because she's normally so sweet and gentle. And we need to be reminded of that this issue with pain and the way that we express it is not so different between humans and animals. It's just we have had blinders on it with animals because they're not verbal about it. And I think that that's really important to remind ourselves over and over again, that cycle of pain is really not that different. And it's biologic, yes, but it's also psychologic and social, and that all of those things play a part. I wanted to ask you, because we have some veterinary nurses and technicians online, and I wanted to ask you, what advice can you give them first thing? Because they're the ones that working in a busy ER or, the 24-hour facility and dealing with these patients that are coming in stressed and anxious and maybe nasty. What's the most important thing? Tip number one, if they haven't been fear-free certified, if they are, they probably know the answer, but tip number one that you could give them to handle these patients better in a way that may prevent this problem from manifesting itself.
So I would definitely say that less is more when it comes to restraint and handling. And also, non-slip surfaces are your friend in terms of handling a pet, because a lot of times the biggest stressor for those pets is being on a slick surface. They feel off balance. They're starting to slip. Temple Grandin, who was a good friend of my dad's and has worked with Fear Free. That's the biggest aspect for her when she's looking at the stress to the pet of going into the vet. It's having those unfamiliar smells and also those slippery surfaces. So when an animal is off balance and when they're slipping, they're about that feeling of about to fall, just like we would be really scared, those pets get really terrified. And especially when they're held down, when they don't have that free movement. And so when we look at what we call it in Fear Free is gentle control. So you look at a way to stabilize the pet and to keep them secure and to help them feel safe. But what we don't want to do is do kind of what my dad calls the pile of techs, where we kind of, go in, it's almost like going into combat. And instead what we want to do is try and work with that pet. And a lot of times using those food distractions, having that non-slip surface, looking at doing the veterinary care just in a different way. So maybe perhaps not up on the table, doing it down on the floor, doing it perhaps on a bench or on the chairs, wherever that pet is comfortable. Now on cat trees, having cat trees in the veterinary office, in the different rooms, in the exam rooms. And so allowing that cat to be examined in those areas when that's possible and practical, and using those food distractions and those food rewards, you can help to really transform that entire visit just with a few of those implementations.
Well, I know that'll be helpful for them because it sounds easy to do, but I know that sometimes they're in a hurry or get frustrated. My thought is that absolutely less is more, and that take your time, and because the reward is much better handling it that way. I do want to open it up. If anybody has any questions for Mikkel, you can type them into the chat and I will ask her. It would be great. We're really talking about pain in veterinary patients and what we are, the correlation between behavior and pain, and how behaviors really may help us identify pain in our patients. So I was hoping that I could open it up for any questions, if anybody has anything that they would like to ask, and also that Mikkel might share a story about a really great personal training situation where you were able to work as a team to better the outcome with a painful patient.
Absolutely. I'm on the spot here. Gosh.
I know you have lots of stories.
I do have a lot. Let me think. So the one that really came to mind firsthand was working with a cat that was having some issues with aggression and also peeing outside of the litter box. And for this cat, there was some underlying medical issues that were going on, and the cat was also painful. A lot of times when we have a cat that's declawed, there can be some underlying pain. And so that's something that's important to be aware of. So if that cat is having that back pain, is having that limb pain, a lot of times they may associate pain with different situations. So if they go into the litter box, for instance, and they ever get a jolt of pain, or it's really ouchy, or it's hard for them to go in, to walk inside of the litter box, that's one thing we want to look at, because that may be one of the reasons why the cat is actually avoiding going in the litter box. And so being able to, with that cat, for instance, it was working with the pet's vet and being able to address some of that underlying pain, and also the cat and underlying UTI. And so we were able to address that and really transform the way that they were interacting with their cat. Play is a big one to look at with cats. So in some situations, people aren't playing with their cats and the cat is really bored. They may take on kind of their own games in the house, which may be stalking or pouncing on feet, or lots of different things that they can kind of devise. And so this cat was very, very smart. And so what we did is we channeled his energy into eating his meals out of different food puzzles, also doing trick training through clicker training. He was awesome. And it was a really neat way that they were able to bond with him. And they also changed the way that they were playing with him. So they were playing with him, but unfortunately they were doing more of that hands-on kind of wrestle play. And so it was very upsetting and overstimulating for him. And a lot of times they would get scratched even in other contexts or bitten in other contexts because he associated hands with, hey, you know, this is part of that whole game thing that we play. And I also feel a little conflicted here. So we took that out of their entire relationship and instead replaced that with more appropriate play with different toys and giving him that mental stimulation elsewhere. And also teaching him just how to be pet. For some cats, it literally is teaching them, this is what this means. And also being able to instruct the pet parent that we want to have those short periods of handling and petting. And so that cat did really, really well. And the family was much happier and scratch-free at the end of our training.
That's great. We're going to stay on cats for a minute because I have a question. Actually, two people, they want to talk about cats a little bit more because it's so difficult with fearful kitties, and especially what can we do for cats that might need long-term administration of oral medications, or how to handle these really fearful hospitalized kitties better. That's a really difficult problem. And from a pain management perspective, being able to utilize training to be able to we're going to need to give this cat a non-steroidal every day for the rest of his life to deal with his pain. How are we going to do this?
Absolutely. So hopefully I'll cover both of those. If I forget, just remind me and steer me back. So when we look at doing oral medications on fearfreehappyhomes.com, we have a lot of great free resources for veterinary professionals, for pet owners. So there are some great resources on there on how to give oral medications to a cat or to a dog and how to do it in a fear-free way. And just offhand though, I want to throw out a few suggestions. So a lot of times a person has tried to disguise the pill in a way that perhaps that pet still got that bitter taste. And so it wasn't done perhaps in the way that was actually going to be helpful. So what we want to do is we want to look at, okay, first of all, is there a way that we can disguise this medication in a way that the cat isn't going to as easily kind of pick around or figure out? And so it may be for cats, it's really that slow desensitization to a situation, trying to add in. So for instance, if we are adding in a new food, some cats can be very, very picky, even new treats that can be like somewhat suspicious. And so they may back off a little. So what we want to do is start to integrate different flavors into their food. So for instance, if we're doing just perhaps a little bit of tuna juice, can be a great way to disguise some of that medication. But if we're doing that, what we want to do is just add in a tiny, tiny bit at a time into that cat's food. So we want to make sure that they aren't slowing down their eating, really paying attention. So with cats who are so sensitive, if they cut back on their diet, it's especially imperative to be paying attention to that. But looking at also, is there a way that we can make a compound of that medication in a way that isn't going to be as aversive for them if they ever do taste it? But looking at ways to disguise it is very, very helpful. But also looking at ways that we can teach the pet to be pilled and still feel calm and comfortable when doing it. So just like with the veterinary visit, we want to have that pet on a non-slip surface. We want the cat to be with that less or more approach, is to be able to allow them to be free moving if possible. In some situations, if the cat is comfortable, they may feel more comfortable and more safe if they are inside of a towel. So that can be a helpful way to allow them to hide and just be able to take the head portion out of the towel to be able to do the pilling. But we want to make sure that if we are doing toweling, that the cat isn't overly stressed and we aren't using it as a way to kind of hold them down, but instead it's just a tactic to help keep them calm. And what we want to do is we want to practice that pilling motion with treats. And so if we are using a pill gun or if we're using our hand, that's where we want to just start off with just doing that pilling motion with treats. And it may just be allowing the pet to, first of all, just eat that right out of your hands or right off of that the pill gun. And then what we can do is we can then practice some of that mouth handling. And when we're looking with cats, we want to be really careful around the whiskers, because those can be really sensitive and ticklish, and it can be very aversive without us even trying to be. And so that can cause them to pull away. So when we're working around their mouth, just be taking care around that sensitive whisker area and getting them comfortable with you starting to pull up their lips, being able to handle the front of their mouth, being able to give them the treat that way. And eventually, and ideally, what we can do is get that cat to where we can get them in a nice sitting position that makes it a lot easier to do that pilling. And so with practice with treats, what we can eventually do is to be able to have a 1, 2, 3 treat type of scenario where we are giving multiple treats with one of those containing the actual pill on the inside in a cleverly disguised way. And a lot of times too, we have to be really careful on how we're doing this. So when we are disguising the pill, we want to actually, so say that we're using a pill pocket, for instance. If we're doing that, in some cases, we may even have another treat on the outside of that pill. So maybe it's a little bit of a turkey hot dog that's then put inside of that pill pocket. But when we're closing the pill pocket, we want to close it with the other hand, the one that didn't handle the medication. Because even just a little trace of that medication on the outside can be a little bit aversive for them for sure. And, looking at things like Fortiflora that can be kind of tasty for them. So looking at different ways to add in that really high taste, high value for them. And also when we are adding in something, so if we are having that pill double coated with maybe perhaps a slim piece of turkey hot dog and a small piece of that pill pocket, we want to make it small enough that the pet doesn't chew so that it's easy for them to swallow. And we also want to make sure that the other treats are all the same. So what we do is we have the one that's called the promise, which is the empty treat, the one that just is a treat. Then we have the deed, and then lastly we have the chaser. So it's almost like, you're taking a shot and then you have the chaser after. Same thing with pets. So we want to get them excited, like, oh, here comes another treat. And maybe we add in a couple more after that. So we get them really excited. And with dogs, one of my favorite ways to do this is actually to teach the dog to catch treats in the air, because when they get really excited like that, a lot of times they kind of snatch it and they're ready for the next one. So they almost swallow immediately. So absolutely just adding in kind of that fun element to it.
Yeah, and so the question with the cats in the hospital that might be really fearful that you're having to medicate constantly or inject, tips for that?
Absolutely. So I think that especially within Fear Free, a lot of times we are also looking at different ways to overall enhance their environment in a way that allows that cat to feel safe. So, and also adding in medication. So a lot of times medications are being combined with other efforts. Maybe it's nutraceuticals, looking at lots of different options to keep that cat calm. A lot of times, just like with pain, when it can escalate, the same thing with fear, anxiety, and stress. So when that pet's already in a state of stress, it a lot of times just builds and builds, and it's really hard to get them to a point where they're reachable. So that's where medications can be really helpful. But the other thing too is looking at ways to help the pet feel safe in their environment. So a lot of times when I work with veterinary clinics, the cages that the cats are in a high stress, like high volume kind of area of the hospital. Lots of times there are lots of different noises or unfamiliar animals going by. What we want to try and do is minimize the noise and minimize the visual whenever we can. And so, if we still are needing to check in on that patient, perhaps it's covering up part of their cage with a cage cover, or it's, or using something like a towel. And within their own cage area, that's where we also want to allow them to have a nice bedding area, absolutely allow them to have a perch area and a hiding area. And that can be as simple as having a cardboard box that just has a hole cut out of it that allows them to go in, or is sturdy enough that they can pounce, or that they can perch up on the top, or even keeping their regular carrier from home. So we want to allow them to have those scents and those smells from home that can help them to feel safe. And so rather than cleaning the entire cage, when we can, we may even spot clean, because cats are so big on smells, and they take comfort in things that smell like them or that smell like home. So having those scents from home that stay with the cat when possible, also minimizing the amount of times that we need to totally strip the cage and clean everything when possible. So that way the cat's own smell can stay in that area. That can be helpful. Using pheromones can be very, very helpful as well for promoting that sense of well-being. And having things like calming music in that area and a white noise. So minimizing some of those stressful noises that may come in. And those are some very helpful ways to help take down that level of stress. It can make it easier to interact with them.
Just breathe, right?
Yeah.
I always think the cat ward should be like the spa for sure.
Yes.
Well, the whole back hospital should be as well. We always say that.
Yeah, and take advantage of those higher cages. A lot of times cats are in the lower to mid range cages, and a lot of times those higher cages, my dad, that's like one of his biggest complaints when he goes into hospital. He's like, that's not meant for paper towels. Be thinking about having some cats up there. Cats are a lot of times they feel a lot safer in a higher space, and so allowing them to be able to be up in those higher cages, just that little change can make a big difference.
That's great. Yeah. So the biggest thing that I just got Dr. B said, cat spa room, totally the best idea ever. She just said in her chat. But I really appreciate this this discussion, because we're going to continue it in October with Dr. Sharon Campbell. So she's on the Fear Free Advisory Board. She's a veterinarian for Zoetis and is also on the IVAPM board. So she's going to talk a lot about the science and the new research about how fear, anxiety, and stress can lead to this vicious pain cycle. So I'm so excited that we were able to do this trainer situation and some great tips. I also want to encourage, and I know Mikkel probably does too, that if you don't know about all the pain-centered education that's on the Fear Free site, go there, because those lectures are great. I think they're really helpful for everybody to really remember that the two are intertwined so much.
That's awesome. I'm excited. Yeah. I will definitely be tuning into that.
Yeah, so next month we'll be back in the evening, so 8:30 Eastern. It'll still be 5:30 Pacific with Dr. Sharon Campbell, and it's October 28th. So look for the Zoom link on our website where we'll be continuing this conversation with Dr. Campbell. Who, yes, is a board certified internist as well, and is going to really tie this all together. And if you have any additional questions for Mikkel, I'm sure you could send them to me at info@ivapm.org, and I can pass them along to you, or even reach out to Fear Free because I know you have contact information there as well on the website.
Absolutely. Yep. Fearfreepets.com. And you'll find me a picture of my dog, Indiana Bones, and Otis. And I don't know if I have one up there yet of my horse, Chili. I'm going to have to do that, put that on my list. But I'm happy to answer any questions. And I really appreciate everyone for joining. And thank you, Jennifer, for this opportunity.
Oh, thank everyone, and thank you very much, and thank everyone for your support and educating, especially this month during Animal Pain Awareness Month. And thanks for joining us, and have a great day.
Thank you. Bye, everyone.
Bye.
Bye.